Hello, Palsy here. This is Pierre from physio in Seattle. I'm going to start with a little background. I am a physical therapist with 22 years of experience, and back in 2015, I developed Bell's palsy myself. I think I had a mild case, and I grew kind of annoyed with the lack of information that were available online, and even asking my different doctors at the time. I had, as a physical therapist, it's something that we are not really used to see, and that's something that you should all remember as a patient, is that 99% of physio have never treated Bell's palsy, and treating facial paralysis is not something we learn in school. So that is something to remember. If you go to a physical therapist, there is likely a chance that they've never laid a hand on a facial paralysis patient. They don't know how to treat it. They likely just Googled exercises and maybe think that using electrical stimulation is a good thing when it's actually not. And so that's just a little side notes here, and I hope you will consider this. So I'm going to answer questions in order that I receive them. So people that send me questions ahead, I will answer first, and then please put your question in the comment if you have more, and I will likely run out of time, so I will do another live to answer them. So like I say, I'm a physio in Seattle. A huge part of my practice is helping people with facial paralysis. And I really developed this practice after having Bell's palsy myself, and trying to help as many people as possible. And I will go over more things later on. So first, another thing I should say is I can only be so specific with each question addressing a particular case, because every case and presentations should be treated as an individual patient. Every case is different and have different presentations. So please bear that in mind. That's how I'll give some example that could work for you, but might not, because the way you do it might have to be tweaked a little bit, and you can only get that info from a facial therapy specialist that can coach you and cue you through those exercises, as well as when they are doing their assessment. So I apologize for this is my first Instagram live, so I am learning with you here. I will make sure to also, this will be on my Instagram feed and available to view afterwards. So I'll start with this. I get that question often. What do you think is the most important thing initially in the at-home treatment for facial paralysis for each patient? And of course, besides the meds, which I've talking to about many times before, I'm just going to talk about the physio side. I think the main thing is you want to, as the paralysis sets in and your face becomes tighter, the main thing is to address symmetry. The symmetry of your face, to keep the soft tissue of your face mobile and supple and flexible on both sides. Don't forget to treat your non-involved side, so your strong side, because that side is going to do some overtime and it's going to get very, very tight. So make sure you work on that strong side and address symmetry. So for example, if the main thing with symmetry, the most common is your nose being pulled toward the strong side, for example, or your lips and mouth being pulled at rest toward one side. So when you're seeing this, your first goal should be to stretch your face, to stretch the area that's pulling you toward that side, in order to regain the symmetry and go back toward the midline. So for example, if my nose was being pulled this way, because all of this here is tight, and I'm gonna remove my glasses here, the main thing to do would be to stretch And spend, even if you're doing a very non-specific stretch, stretching toward the midline here. Stretching your nostrils, for example. So sticking your fingers in your nose, stretching this, stretching your lips toward to regain that symmetry, stretching the tight area here and bringing back everything kind of in the middle. And I think this is a very important concept because you need to have that symmetry at rest before you can practice any movement with your face, before later on in the paralysis stage of Bell's palsy, once you started having regaining some movement, because if this still happen and you try to smile or you're trying to do any kind of motion, you're going to have everything's going to be crooked, and this is really not going to help you regain the face that you had before. So to me, that is addressing the symmetry, and of course that's through massage and stretches. And massage and stretches is on my hand as a physio the most important thing. This is how you, and I will keep talking about it several times during this live, this is how you avoid reaching synkinesis. Synkinesis. So I'll wait for that to go into more detail about this. So the first question I had was from Stacy. She said 9 months with Ramsay-Hunt syndrome with synkinesis. It's affecting my smile and I can flare my nostrils. Recently having twitches around mouth and cheek and nostril. Is that normal? So something you should all know is twitching is totally normal when your nerve is healing. That's generally a good sign. It means that your nerve is making a new connection on the muscle. So you got new sprouts of the nerve endings onto that muscle, and that generally results in twitching. You could have twitching for other reasons, but generally the twitching is not a bad thing, and I don't think you should freak out if you experience this. I remember experiencing that myself when I had Bell's palsy. That didn't last very long, but I didn't really panic or anything, and it just turned out fine. So the twitching is quite normal, so don't be worried about that. And from the info that Stacy gave me, I gathered that her eyes closing is making the mouth move. That's called oculo-oral synkinesis, which means the brain has basically relearned to close the eyes with moving the mouth, because the soft tissue between the two is tight and connects them by preventing one from moving from one another. So when you have that kind of stuff happening, that means really where you should spend the bulk of your time stretching and massaging is here, because you've created with the tight soft tissue, everything kind of just shortened here and is being held, and that you've created a communication between your eye and your mouth movement. So this is really where most of the stretching should happen. Let me go back to this. Let's see. Yeah, so the concept to understand with the synkinesis is that you want to basically smooth out the area that is tight and that feels thick. So you can find where to actually work is by comparing both sides. You want to try to do this, if not every day, every other day, and comparing both sides. And the best thing is to go inside your mouth to compare both sides. So here, just feel and appreciate how thick, if this is my strong side, appreciate how things are moving. Go to your involved side and compare. So you could have thickness on the strong side, but also especially at first, because when the paralyzed side does not work, this is doing overtime and it's become really tight, and this is why you need to stretch this out. This is what's going to contribute to that asymmetry. So I think that should be a priority. Work on that first, and then. So in her case, with the eye to mouth synkinesis, I would really spend time stretching this area and going very slow. And I basically use my 2 fingers here and holding the tissue just to a certain amount with a certain amount of pressure. You don't want it to hurt too much. It might be uncomfortable at first. That's okay. Generally, those points that you really want to work are very uncomfortable. So just do what you can to your tolerance. And please know that it's a slow wins the race. You are never going to see just a complete recovery overnight with that kind of stuff. So it's a slow process. Okay, so I'm gonna kind of hold here and just progressively stretch this out. What I would do with this is do 3 to 5 strokes. Take your time, go very slowly, 3 to 5 strokes on the same spot, and then kind of reassess how it feels. For the most part, you're going to feel a lot of like pressure and tension release, which will be good. Let's see. Where was I? So yeah, well, like I was saying, when you feel the thickness, you should guide your treatment as to where you should really spend most of your time. And the concept is basically also with synkinesis that's going to help you is that you want to stretch the muscle that is overacting during a certain facial motion. By stretching it to the opposite direction, it is going down toward. So for example, people that have a difficulty smiling where this is so tight that it keeps everything down and prevents your upper lip from going up. And that's an example I'll go back to. Basically, you want to stretch this area because this is what's keeping things down. And that's the hard part. I think as a patient, obviously I know this because this is my job. I work with people on this, but as a patient, it's tough to figure out what's tight and if you have to know the anatomy. And this is kind of where I would suggest you work with someone to help you with this, figuring this out, at least for a couple treatments, so you can really get all the bases, so you can work on this on your own. So if you're tight here, this is preventing. So it's tight right there, keeping things down, preventing things from going up. So what you want to do is stretch in the opposite direction that it's pulling you toward. So here, and then I would stretch like this. You could certainly do massage first. Again, between index and thumb, just kind of smoothing out that area, and then stretching up like this. So when you hold the stretch, hold that for a good 30 seconds, and I would do like 3 to 5 stretch like this. So with Stacy, some common places I would address in her case is take a closer look at the area by the nose on the cheek that tends to be super tender, and it's also here. So I would spend some time doing what we call trigger point release. So same thing, you're gonna use your finger, holding here for a minute with the pressure, the amount of pressure you tolerate, just like this. So hold that for a good minute. So make sure to put your finger in your mouth. That's really gonna be, you're gonna get your best result doing that. And then what you can do from there, then you're gonna work on stretching the area with slow and controlled stroke, kind of in the same manner I was doing. So if you're here, after that 1 minute trigger release, I'll just really stretch, kind of iron this out, flatten it out. This is kind of what you want to do as a goal. If you're doing this over a week, for example, when you start, you're going to have that thickness toward the end of the week when you're working on this. And it might take longer than a week, of course, but you should feel like it's flattening out, as it is not quite as thick and dense, and is going to move a little bit better. So this is one common spot that needs to be generally addressed with synkinesis. That's very often completely locked up, and the reason is there's a lot of muscle that are convening in that area. And same as here, this area is called the modulus. And it's a spot by the corner of your mouth where many muscles are all bound together. So there are at least 8 muscles controlled by the facial nerves that meet there. And so it becomes really important to regain some mobility and some flexibility there. So in the same manner as we did here, I would do the same here. And if you follow that nasolabial fold here, you're gonna go right on it or at the edge of it. Put some pressure and stretch this out. And don't be scared of really stretching, really putting pressure. You're not really going to damage anything doing this. You're just going to stretch that soft tissue that is very, very, very tight. So I'm moving on to the next question. That question was from Anna. About synkinesis, I have now 3 months with Bell's palsy. I took medication the first month, acyclovir and corticosteroids and eye drops. Until now, I considered I have recovered 70% of facial mobility. I had 20 sessions with a physio that I started 2 weeks after Bell's palsy started. Synkinesis has appeared and I don't know if I have to take another measure. My physio told me only expression needs to be retrained. I also did electroacupuncture for the first 2 weeks. So first of all, synkinesis tends to start at the end of the 3rd month into the 4th month when it shows up. That's and synkinesis being the last stage of the facial paralysis, generally starting with flaccid paralysis, paresis, when you start getting more movement, and then synkinesis, which is obviously an optional stage. Hopefully you are not getting to that stage, but that is considered the last stage. Yes, Anna, where first of all, so were you officially diagnosed with synkinesis? I would, or is it something you think you feel you do, or have you worked with anyone in that regard? Did you see an ENT? Hopefully one that specialized in facial paralysis. And what I would recommend anyone in Anna's shoes is to consult with an otolaryngologist. That's the official name for an ENT, ear, nose, and throat doctor, otolaryngologist, and one that particularly specializes in facial paralysis. They all have subspecialties, and so I think if you work with one that sees facial paralysis with patients throughout the day, it would be ideal. So that's type of doctor that should be the most versed on this topic and be able to help you and diagnose you correctly. They will also likely, hopefully, work along with physios that specialize in this. Also, what kind of that's my question for Anna, is what kind of synkinesis? There's really so many thousands of scenarios that can happen, and just knowing that you have synkinesis, I'm not getting enough information to really tell you and really guide you it's one way or another, because I don't know what movement brings on your synkinesis. Hopefully some of the other example I'm giving will be applicable for you. So if you have synkinesis, please know that it does not go away on its own. I cannot repeat that enough. It is an extremely complicated thing to treat, and just thinking it's going to go away by itself, it would be great, but it's just not the reality. So the reason why it appeared in the first place is really what needs to be addressed. And so loosening up loosening up the tissue first, then relearning the right pattern of movement with slow and controlled movement. And sometimes in combination with stretching is really what you want to do. So a trained facial specialist therapist can help you with that. There are sadly not a lot of us around. So another thing to know is that most physio, and I think I mentioned that before, that most physio, 99% of physios do not know how to treat facial paralysis, and most have never heard of synkinesis. So that should be, if you call a physio place and they don't know what synkinesis is, just run away. Also, most doctors do not know that some physios specialize in the treatment of facial paralysis. So if you have found someone to work with, we're a few to do online consultation online. So make sure that you mentioned that you talk about it with the doctor, make sure that you want to try this, not that you need a prescription. So you can do this on your own, but I think working with a otolaryngologist is always a good idea. Also, she mentioned only expression needs to be retrained. That's what she was told by our physio. So that is not true, especially if the soft tissue muscle has not been prepped first to be retrained. So it's pointless to try to make a muscle move if there is no nerve conduction. So in the in the paralysis, flaccid paralysis stage, early on in the recovery, if you have no movement, please do not practice movement of the face. You're wasting your time. And B, if the asymmetry and tightness from tight tissue will prevent relearning the correct facial movement. So you have to address that symmetry before you can practice and relearn the correct movement. On to the next question. So that's from Deirdre, I'm not sure how to pronounce that. I would most want to ask, what I would want to ask is, stress and lack of sleep are a contributing factor toward developing Bell's palsy. I'm going to say yes. Stress and lack of sleep and fatigue decrease your immunity, and that places you at more risk for developing Bell's palsy if you are exposed to any of the virus that can trigger a reaction, an immune reaction, and trigger would start the Bell's palsy process and the inflammation of the facial nerve right around that area, deep in there. This question from several people: is it safe to use electrical stimulation? I'll be quick on that. I'll say no. All the latest research shows that the risk outweigh the benefit when using e-stim in the treatment of facial paralysis. So, a little disclaimer here. When I had my Bell's palsy, being a physio and being not yet necessarily versed and knowing all those things that I know now about treating facial paralysis, I used electrical stimulation, a very specific kind though. And I was trying to, it's like a gun, and I was trying to target one muscle at a time. I knew how to do it slowly and with control, but I have stopped using electrical stimulation with my patient anymore. It is just, most of them do not work. Most of them are too big and create mass stimulation of the face, which would be retraining several muscles of the face to work all at the same time. That is exactly what you do not want to do. This is what basically is synkinesis. So the problem with the stimulation is that it targets, like I said, too many muscles. And the face is a pretty small area, so you will stimulate several branches of that nerve at once, all those nerve endings there. So this is what you want to avoid. So I will repeat this: do not use electrical stimulation. Since I've changed the way I practice with this, I looked at all the research, and there's really nothing that is convincing to use electrical stimulation, really, except in very, very rare cases of several years of complete facial paralysis with absolutely no movement, which I very hope most of you are not in that situation right now. So again, don't use electrical stimulation, no matter what kind. The electroacupuncture that a lot of acupuncture do, I would be careful. First of all, you make sure it does not hurt. If you feel like you have several parts of your face contracting all at once, I would just avoid it. Next question from Raquel. I had my Bell's palsy back in December of 2020, and I talked with you about it. Yeah, that's right. I remember Raquel. So that was affecting your left side of her face. I got about 90% of my facial movement, but I noticed in the last year that my eye has gotten noticeably smaller and restricted movement. I didn't have any issue at the beginning. It was more my mouth and cheek area. Any guidance is appreciated. So with Raquel, what I would look at in your case is the flexibility and mobility of your eyelid muscle, your orbicularis oculi, which is pretty big. It covers this entire area and kind of blends with your eyebrow muscle, your forehead muscles, and those muscles that are here. So I would look at the flexibility, the mobility of that muscle, and I would try to see if you feel a difference between moving your when you close your eyes, for example, and I would do this very slowly. Do you feel any difference between each side? And do you feel more like your involved sides, for example, where you would have tightness in pretty much, it could be anywhere around here. So if you feel also, what you could do is test from the outside, just move things around. And if you compare both sides and you feel that it's not moving, you feel like, oh, I'm kind of running into a block here, then this is basically where I would go. And this is where I would stretch that area. So make sure when you stretch using 2 fingers, if this tight spot is here, for example, go here, and stretch apart and hold. Make sure that you don't put lotion so your finger doesn't keep sliding. Stretching is you want to hold that nice and steady there. If it slides, you're just basically massaging, which is not bad. That could be a good precursor to the stretch, but not going to have the same effect as holding a stretch for a certain amount of time. There we go, into that position. So basically anywhere is fair game, and this is going to depend on the presentation, again, where you feel the tightness. I would also very much stretch your eyelid, and this is always something that needs to happen in most people in order for them to close their eye. I would massage the whole area around your eyebrows, for example, even grabbing your eyebrows, just moving them up and down, side to side, spending a few minutes with this, stretching your forehead this way. You can same thing, hold that for 30 seconds, up and down, all that kind of stuff. And then an area that tends to be often tight is this corner here. So I've had a lot of results, and I'll go back to this when I mention an example with a patient, but stretching this in that direction here, right there, holding this nice and steady. Another question. This one actually is kind of a double question from Melody. Hi Pierre, I've had Bell's palsy over 12 years ago and I still don't have a complete full smile, and I want to know if there's anything I can do about it. Thanks. And then Sandra, is there hope for someone 2 years post Bell's palsy? So Melody and Sandra and everybody else, it really depends on your history with Bell's palsy. Did you massage and stretch your face for several months when you were first diagnosed? Did you practice your smile in a slow and controlled manner? Did you use electrical stimulation? What kind of treatment you've had? What is your medical history? Do you have other part of the face, inner ear involved? Do you have vertigo? Do you have Bell's palsy? Do you have Ramsay-Hunt? There is so many different scenario, and just like I explained earlier, you likely have some very tight tissue and fibrosis in places, and that is very likely contributing to Melody, not getting your full smile. So that's something that needs to be addressed. I always like to stay optimistic when people tell me they have been dealing with side effects of their facial paralysis for years, because most people have certainly not, and very likely have not done targeted massage and stretch like I teach people and like I do with my patient. Because most of the, it's really a truth is most patients do not receive physio treatment. They are never sent to a physio by their doctor. When they are, that physio has never really treated facial paralysis, so that can be a disaster. People do not feel confident about the physio's ability to treat them, which is fair since they have never treated this. So, but anyway, I like to stay positive, and I say that it's if you have not really done what I consider the appropriate rehab, well, then maybe it's worth a try. And so my answer is yes to this, and it's at least worth trying the right stuff if you have not. And I've had some patient with synkinesis who like just one stretch made really all the difference in the world. We spent some time. It wasn't necessarily easy to find that area that is really restricted and limited in flexibility, but once we found it, they really released a lot of really improve their movement pattern, and that they were struggling with synkinesis. And even sometimes, after several years, I've had patients after a decade. I've seen them a couple times. We've done a couple stretches that were really targeted, and that really made a big difference. Even like at the end of the sessions, when they walk out the door, they are seeing an improvement. So next question from Heather. I've had facial paralysis for 21 years and struggle with mainly synkinesis and still a lack of movement in the left side of my face. I have done supplements, a heavy metal detox, going to try that one more time in the future. Facial massage and exercise. I prefer to stay with the natural approach to healing. So what do you recommend that I haven't tried? So Heather, a little bit of what I've said for Melody. I think you mentioned doing facial massage and exercise. I will ask the same thing, is what kind of exercise? What is exercise? Because I really consider the massage and the stretch to not be an exercise, and especially early in the paralysis, I would say do not exercise your face. I said that to all my patients, do not practice trying to move your face, because you're wasting your time and you're recreating all bad habits pretty much. And practicing faces, where you're practicing faces, trying to make your face move as hard as you can, or what is more targeted, but that's what I recommend anyone to not do. So to answer that question, it all depends on if I don't know what you tried and what you did. So if you haven't really tried and worked with somebody that specifically know how to treat this, you probably were not giving the right exercise. So that's kind of where I'm coming from here. So a little bit to go back to the synkinesis, treating synkinesis is also a team effort. A facial physio, an otolaryngologist, sometimes you'll need a plastic surgeon as well. These are all people you want to work with to address the synkinesis. Don't go alone at it. It's difficult, it's complicated to treat. Sometimes you might need some Botox as well. Botox can work very well when it's properly placed and done by the right person. As well to, basically you want to allow the overactive muscle to finally quiet down so you can practice another controlled facial motion without that tight muscle overacting. So again, I get that question a lot. It's been a while, I haven't progressed, I've tried all this. That, again, it all depends on what you have done before. Another question from Kristen. Specific stretches for more upper lip movement after depressor anguli oris resection. So the depressor anguli oris is this muscle that lays right there. And this is the muscle that we tried to stretch earlier that can get very tight and in the way of a smile, because it's going to kind of keep that lower lip going down. It's too tight, and so the procedure that Kristen had is it can be fairly common in that scenario. Hopefully you never had to go through that, but due to the tightness of that muscle and the weakness of like your zygomaticus major, your smiling muscle here, as well as all the muscle that lift the upper lip, so that could be your levator labii, that could be your levator anguli oris that is like this, or your aliquinazi that runs here. All these contribute to doing this movement. So I'll show you this. So if you have some movement at least, then practicing slow and controlled raising of the lip, both with a smile. So if you have enough control, this is about the speed that you want to go at, as long as nothing else happens. You might have to use a finger to help you. And once you think like you have it, hold it for 10 seconds. But again, you might need some guidance with this to do it correctly. You might have to stretch first. You might be needing to be cued through this. So it's, again, it's very hard to be just so specific to one person and condition when there's so many possible scenario here. Also, for example, practicing your smile. We're going to go on the smiling muscle here. Holding for 10 seconds. But this is basically the speed you want to go at. And then with your finger, you're just slightly assisting this. And this can take, weeks of working on this to kind of see a difference, and really having just these muscle, isolating these muscle to work versus, and while you practice this right after stretching this, so everything kind of calms down. So let's see, where are we? So there's other things, of course. Like I said, the scenarios are endless, and that's why it's tough. I have another question from Christina. If we feel synkinesis is setting in, what should we do to prevent it from getting worse? So it's basically what I've kind of been talking about along here is, if you feel that synkinesis is setting in, what I would do is really continue with all the information I gave today. Continue powering through massage and stretches. Work on these areas that you really feel are restricted. I can guarantee you that if you go inside your mouth, compare both sides, you're going to find some really thick and tight area, some tender area, and those are the ones that you really want to address. So during that time, if you feel like closing your eye is creating that synkinesis, please do not practice that movement. Don't practice because you don't want to teach your brain to that movement pattern. If you do it often enough, which is what happens when people exaggerate movement and trying at first, especially when nothing is moving, they're forcing. It's actually really bad. It's just reteach your brain to do that movement every time you're gonna either smile. So when you force, your eyes are closing. So you're teaching it to close every time you're moving your mouth. So avoid that, please. And then, of course, reach out to a physio or an ENT. But the main thing is to avoid getting to the synkinetic stage. And that's why I cannot reinforce the necessity of massage and stretching as early as day one. The first day you're diagnosed, you should already start doing that. The sooner you're going to do this, the less likely you are to have synkinesis. And of course, that goes along with taking the meds and all that within the first 72 hours. But your goal is to the key to avoid synkinetic stage is to lengthen the soft tissue and then make it more flexible. One of the reasons it's so tough is, facial muscles are very different than other muscles in our body. A lot of those facial muscles actually are floating. A lot of muscles in the cheeks are actually floating. They are not attached to bones. Some are on one hand and then not on the other. Some are on both, but some are just not attached to bone at all. And so they act very differently than a different muscle. Also, in regards to your ability to have control over those, 50% of facial movement you do not have control over, because it's controlled by your limbic system, which control your emotion. And that should tell you something too, is when you're trying to make a face, when you don't have the movement is, you know, when was the last time you actually smiled like this, or closed your eyes like this, or did this? We do not do this in life. Anything that's forced in the treatment of Bell's palsy and facial paralysis and Ramsey Hunt and all this, that does not work. You can't force things, because again, things happen organically. Our emotions are just happens. We don't have control over them. You're watching TV or somebody's telling you something funny, you're gonna smile, you're gonna laugh. Something is coming at you, you're gonna close your eyes or you're gonna make a face, and those just happen. You're not thinking, okay, I'm gonna do this movement. Just not like, okay, I'm bending my arm. I have complete control over this, if I'm moving my arm or not. But some of these emotions you do not have control over, and I think that really differentiate facial muscles from other musculoskeletal muscle, and this is also why the treatment should be different, because I think you're not, if you're treating it just as a regular muscle, you're not going to get the result that you would like. So again, the main thing is to avoid synkinesis is to do the right thing at the right time. And that might sound very, very cliche, but that is true with pretty much anything in health, and that involves medical treatment. Generally, the sooner you address something, the better. Just sitting around and waiting is not really going to help you. And I know it's so tough, because a lot of people they don't know anything about Bell's palsy or facial paralysis. They go to their doctor. They're told to just wait, come back and see me in 6 weeks, and that's where I'm trying to. This is where my place is, and this is where I want to educate people as to, you should be starting from day one to work on this, not wait. Do not wait 6 weeks. There's nothing in life that really happens or that is positive and good that you don't have to put work into it. At least that's kind of how I see it. And I think that really applies here. So now I'm gonna give you a few scenarios of synkinesis, and then show you maybe what I would try first in that case. Again, that's within just being fairly just 1 or 2 dimensional. They're not seeing the whole picture, because there could be a lot of things happening. So again, the first thing is you want to have symmetry at rest. So if you don't, you need to start by addressing the pull of the muscle that is making your face asymmetrical. So if you're being pulled this way, if this is your resting face, this means your mouth needs to come back in the middle, right? So that means everything acting here is just pulling this here. So everything here needs to be stretched. And once again, so you could do also, if you're at work, you don't want to stick your finger in your mouth. Another good stretch would be to just kind of do a kind of this movement. That might help a little bit. It might help kind of relax the face, but I would just kind of go inside your mouth and then just do some stroke like I showed earlier. And that's gonna help you. Same thing with the nose. If you feel like you're really tight here and pulling, I would just go all the way up to here, and then stretching this out, also stretching the nose in this direction and holding. So some concrete example of synkinesis. So, and those are like with patients that I have been working on before. So a lot of people have, whenever they close their eyes, they feel various things here. They could be here, anywhere along here generally. So that's oculomotor, oculo-oral synkinesis. And if you feel like a twitching, you feel a little, just a gentle lift here, what you want to do is identify, so find that spot. And let's say we're going to take the modulus because it's such a common place here. And then just starting to stroking that area to Again, flatten it, iron it. And I will spend a decent amount of time on this. What you want to do is try to stretch in every direction. You might find one that works, but that is the most tight, and this is where you want to spend most of your time. You could do a trigger release like I did earlier, where you are going to pinch here and hold first before you do all these stretches. And then what you could do, if you feel so a little lift of the, if the movement is a little lift of the lips when you close your eyes, then once you've massaged it, what I would do, just recheck, and if you still feel something, what I would do is just stretch. You want to stretch again in the opposite direction of the pull that you're feeling. So if every time you close your eyes, you're feeling a pull in this direction, and go here and hold that stretch. After several rounds of stretching, you can try to close your eyes at the same time. Once you practice this several times, you might feel like there's a lot less happening here. So that's something, in that scenario, that's what I would do. I would target that area. Now another example of your mouth raising and pulling kind of up that way. Same thing when you're raising your eyebrows. I have a patient currently who that's the case, and we've been working on really releasing the whole cheek. And so if you're doing this, something, and you feel this is happening, this is where you want to spend your time. And again, if the pull is in this direction, massage. So iron that muscle here. And generally with everything with this is slow wins the race, so always go slow when you massage. For the sake of time here, I'm going a little fast, but spend your time. And then, same thing. And you see here, I'm trying to go very slow when I'm doing this, and that's very important. Just the slowest, least intense movement you can do is really what's going to bring you the best control. So again, and it takes quite a bit of practice because it's not easy. We tend to do things fast, and it's not paying off generally with this. And my next example would be eye closing when puckering or smiling. So that would be oral ocular synkinesis, meaning the eyes gonna move and close when you're doing a movement with your face. So that is the same thing here. I would spend, so if your eyes close, I would figure out the tight spot around your eye. And so let's say it's here, and that's making, this is all kind of constricted here and making your eyes closed every time you're doing this, because this is, everything is kind of connected and short here. So what I would do is, again, same thing, stretching here, spend some time, find that tight area, stretch, 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 hold. And then after you've done a round of 5 to 10 of those, holding 30 seconds, what you can do is, as you hold the stretch, practice slow smile. In the same manner as what we did. So I hope that kind of give you an idea. I'm sure your case might be different. There might be some tweaks you need to do to this, but I hope that was informative to kind of show you what kind of thing you need to do with Synkinesis. And that's from the physio side, from what I do. Again, there's other treatment. If all else fails, if the massage and the stretch are not enough, the Synkinesis still persists, you could have blocking that overactive muscles with a Botox injection or the sport. I don't do that personally. I don't think I have the right in the state of Washington to inject anything, so that I don't do that, but I refer my patient to a otolaryngologist. So let me see, I'm going to try to look what questions I have here. And yeah, wish I never did electrical stimulation, as convinced it's caused my Synkinesis. It's possible, and I mean, I think don't go back too much in the past and just kind of move on. It's not like you can't change it. So it's just work on the positive. And somebody, can strep stop recovery? Yes, I mentioned that earlier. Yes, it does. And is it possible to have Synkinesis but not to feel where the tightness is? Yes, and for that's kind of what I was talking about. What you need to do is, this is where you need to do your own investigation. I mean, you might need the help of someone, of course, that does that for a living, but just really try to find places that are not moving very well, that are just feel stiff. And the best way to know if that's the case is to compare it with the other side, with the side that is not affected. If you have, in more rare cases where you've had Bell's palsy or Synkinesis old Synkinesis on one side, and now the other side is affected, that can be a little bit trickier, obviously, to figure out that area. But always use your sound side and then just compare, just really palpate, see and move the skin, see where generally the tenderness will kind of guide you in this. So that's what I would use as a benchmark here. Let's see, what else? Can I stretch the eyelid, my eye closed a bit, when I chew or flare my nostrils? So is it with every time you eat when you chew, or is it just when you exaggerate chewing or flaring your nostril? I personally can't even really flare my nostrils, so I kind of give up on that one. So stretching your eyelid, yes. Stretching your eyelid is very important. It's probably the number one thing I would do, because your eye is very much your priority. You don't want your eye to get any infection. You want to keep it healthy, and that's why closing your eyes and stretching your eyelid is very important. So you could use fingers here, depending on the width of your eyebrow, 2 or 3 fingers, and then with another finger just kind of go right over your eyelid. Stretch. You could stretch in different directions. Some people tend to be, it's very often they're more tight on the inside. So what I like to do is stretching kind of at an angle a little bit more. Trying this and figuring it out, you're not gonna create any damage. So you have my go. Just go for it. See what direction of stretch gives you the most relief and works the best for you. So let's see what else. When I try smiling, my mouth immediately pulls my eye closed. Yeah, so again, with everything we mentioned, that means there's likely, so you get some fibrotic tissue here that's probably holding all this tight, and this is where you need to start. You need to stretch this whole area, and just go back in this video earlier. I kind of showed how to do some stretching for the cheek, and this is where I would spend the bulk of your time in the stretch and massage if you have that presentation. Let's see. I've never seen stretching from the inside of the mouth. Very interesting. Yes, I think that's what works the best, and I get the most result with. So yeah, you might, if you're not uncomfortable putting your finger in your mouth, just use gloves. That's completely okay. Some gloves have the tip is anti-skid, so that works out well. Let's see, it's still possible to get rid of synkinesis after a year and a half. Yes, it is. Again, like I mentioned before, it's a very slow process. It takes a lot of work on the patient side. It takes learning the correct technique, the correct stretch, the correct approach to relearning the movement without the synkinesis kicking in. And that is quite a process. Let's see. Unfortunately, the twitches never, let's say, hey there. Unfortunately, the twitches never go away, even after 21 years. Yeah, and that could be some of that could be some hemifacial spasm. That's a possibility, and that's something to see an ENT for, I think. Let's see. Can synkinesis be resolved after 2 years? So, how important is relaxation in the recovery process? Life is stress, like if stress can't be avoided. Yeah, that's a big. It's hard to find a completely stress-free life. I'm not sure any of us are living one right now. But the more you can remove yourself from stressful situation, the better. Remove yourself from anything that's, anyone or any situation that are toxic or making you stress, for sure. This is, think of this as your body telling you that you actually need to rest and need to take time for yourself, to encourage more healing. And I think, some of us can do that. Some people can never relax no matter what. That's a different topic, but I think the more you can try to relax, the best. There is a facial relaxation meditation, and I'll put this in the link under this, where I think it's going for quite a while. It's maybe 30 or 45 minutes, and you just listen and you just get in a comfortable position and then follow the whole thing. And that could be, I think it helps quite a few people. So that's something maybe to try in your case. I think that was Dina that has that question. Let's see. And I think that was all the question. Let me go back to the most recent. Yeah. When I do that, my eye flickers. Yeah, that I would have to look at, have a better assessment on that. I'm not sure when that happens or with what you do. So when I show my lower teeth, my affected side is still weak after 2 years. So that means that this muscle here, the muscle that lower your bottom lip. So here, the pouting muscle, that's the mentalis. So, but it's likely more in your case, your depressor labii inferioris, that's here, and then your DAO, the one we talked about before, the depressor anguli oris, and that are not doing this enough. So it could be because it's tight and just kind of bundled here and there's not a lot of movement. It's not allowing the muscle to contract and glide correctly to create that movement. So I would start, with massaging and stretching like we did, but otherwise you can do some simple movement here. Also stretching in this direction. You might feel a good stretch there. And then once you stretch, then practicing, and I don't have a ton of control with this one. Because it's more my jaw moving. So if I block my jaw, but you can help it once you stretched it, going slowly. Same thing, holding for 10 seconds. Same concept as what we did before. This is kind of where I would start, but it's likely there's other thing going on that needs to be addressed in order to make that happen. And I think that's it. So we are right at an hour. Thank you for hanging out. I hope this was helpful. You can certainly send me DMs. And like I say here, I can only work and help you so much through this. Sometimes you just need to just back up and then see, finally, have an official consultation in order for this to happen. So as if you're not aware, so I'm gonna repost this on my Instagram page. I will also repost it in my Facebook group, the Bell's Palsy Solution. I also have the Bell's Palsy guide. It's a ebook that is free, and if you have just been diagnosed with Bell's palsy, please look at it. It's going to guide you through what to do initially, to what you should be doing. I have the Bell's palsy tutorial. That is a full-fledged class that is online, accessible via password. It's more than 2.5 hours worth of videos where I show all these techniques and stretches. It works out very well for newbies, the one that just started developing Bell's palsy. It's everything you should know is in there, I think. And it can also really work for people that have never done any of these stretches or have been very good at targeting those areas. And so that can really help people, even if you're still struggling with some deficit in facial flexibility or mobility, as well as if you have not regained full movement. And if you have some synkinesis, you can really find some gems in there. So that's also available on the link is in the profile of all of the links actually are in the profile in Instagram. And I also offer consultation to anyone that is willing to work with me and put the work into it. I have 30, 45 hour consult. I've been helping people for, I would say now, 4 or 5 years. And I've had people from Australia, from Saudi, from England, from Ireland, Canada, the US, from India. So a little bit from everywhere. And I think I've been able to help them. So consider this, but just start. I hope I gave you enough information to start working on some of the problems you're dealing with your facial paralysis. And if I keep getting, you can feel free to always send me questions. And I think when I have enough questions, I can do another live on a specific topic. I have been debating on starting also a podcast, and this might happen over the next year. We'll see if I have the time. But anyway, thank you for hanging out, and I hope this was helpful. And I wish you the best, but be sure that you are not alone in treating your Bell's palsy or your facial paralysis. There's a whole community of people and people that are willing to help you. So don't forget that we are out there, and I will catch you later. Bye-bye.